Okay, so these notes are going to kind of guide me. I'm going to quickly talk about management of care because that's one of the topics that NCLEX is going to be testing us in. And when we think about the topics, we get that information from the NCLEX test plan on NCSBN. So when we think about management of care, we're talking about advanced directives, advocacy, advocating for a patient, assignment, delegation, supervision, and I'll talk about delegation. Just remember though, delegation is someone acting on our behalf, and we cannot delegate anything that requires critical thinking or judgment. Okay, that's going to be really important for the registered nurse to not delegate anything that requires that clinical thinking or judgment. So initial patient assessment must be done by the RN. Initiating a patient care plan must be done by the RN. And we have to think about the 5 rights of delegation: the right patient, the right task, or actually the right person, I should say. So within their scope of practice. So we'll talk about all of these things. We'll talk about HIPAA, the Bill of Rights, continuity of care, confidentiality, ethical practice, all of those ethical terms, right? Whatever book you're using, if it's Saunders, make sure that you review those terms like tort, malpractice, negligence, assault, battery, and non-malfeasance, like all of those, totalitarianism, or I'm sorry, utilitarianism, meaning the good for all. I'm still probably butchering that word. Justice, equality, veracity, those are all words that we have to know the meaning of when we talk about, ethics and that kind of thing. All right, so this is just some kind of intro information. So let's jump in with advanced directives. So when we think about advanced directives, these are legal documents. Now, nurses should not be witnessing the signing of these documents, but what we do need to do is ask the patient if they have these documents and make sure that they get into the patient's medical record. Okay, so there's living wills, healthcare proxy, power of attorney for healthcare. The big thing with all of these different kinds of legal documents is the patient is, when they're of their sound mind, they are appointing someone to act on their behalf to make medical decisions if the patient is incapacitated. So that's the big thing that these, documents provide for the patient. Okay. All right. So Self-Determination Act, that act tells us that the patient is making their own decisions and they have the right to refuse care or accept care. So my patient does not have to take their medication. They can refuse it. Patients can leave the hospital against medical advice, with the exception of patients that are of danger of harming themselves or harming others. Those are the only sets of patients that can be kept against their will. But any other patient can refuse care, refuse medication. They can leave against medical advice. Okay. Now, when we think about the Uniform Anatomical Gift Act, that means that the patient can donate their organs as long as those organs are not diseased by cancer or something like that. If the organs are in good shape, they can actually donate their organs. There have been cases of moms that have given birth to babies they knew that would not survive, but there were some good organs in that developing fetus, so they gave birth to that fetus. So they can donate the organs, and that's really tough. Now, if the nurse is involved in this, the nurse's role is going to be to help prepare the body. So for example, if it's a cornea donation, we have to put sterile moist gauze on the eyes to make sure that they stay moist until the organs can be harvested. So, and again, the patients can donate their organs or they can donate their entire body to science. That is a possibility as well. Okay. So when we think about life planning, we want to make sure these advanced directives are in the patient's medical records. Okay. Now, advocacy, We are going to advocate on our patients, right? We are going to advocate for our patients. And so that includes giving them information so they can make the best possible decision. Also involving other members of the team, like a social worker, maybe a chaplain, maybe a specialist. But that is our job, to advocate for our patients and to teach our patients how to advocate for themselves, to teach their families how to advocate for them as well. When we think about assignment, delegation, and supervision, it's really important to understand that if we are delegating a task, someone is acting on our behalf, but that does not relieve us of the right or the responsibility or the accountability of making sure that that patient care has been done. When we are delegating, we have to know the 5 rights of delegation: right task, right person, circumstance, communication, and supervision. Should this task be delegated? And again, if you see an NCLEX question and the patient is unstable, this is a scenario where the patient is just recently post-op, they cannot be delegated care, right? If the patient's
For
outcome,
24 hours.
say again?
For 24 hours, unstable patient or out of surgery has to be 24 hours. The RN has to take care of the patient.
Right. Now, I will tell you that time frame, it also kind of depends, because I could
On the
have a patient that is 3 days post craniotomy. I'm not going to delegate the care of that patient because that's a craniotomy patient, right? In three
stable.
days, they're
Yes,
not
ma'am.
stable. So,
Mm.
yes, I agree that someone that just came out of surgery, they're not usually a stable patient. But when you look at it, look at all the patients, and think, okay, which condition is the most serious? And because that could be really tricky, because you're like, oh, well, it's 3 days. They should be fine. But it's a craniotomy. So that is really not necessarily a stable kind of patient. Okay.
Amen.
Yes. So, but yeah, that's going to be the breaking it down. Okay. So, should this task be delegated? And remember, we have to delegate within the scope of practice based on the Nurse Practice Acts. Okay, so if I'm delegating to the LPN, I cannot give anything that requires initial teaching, but they can reinforce teaching, right?
Yes, ma'am.
Yes, okay. Awesome. So those are the 5 rights of delegation. And when we're communicating, we have to make sure that we're clear in our direction. There's no, ambiguity. And even when we are, working and talking on the telephone, we want to get proper repeat backs. That's going to be important. Even when we're talking with the doctor, we want to make sure that we give a proper repeat back, because that's how mistakes, can be avoided if we properly repeat back. Um, so those are the 5 rights. And again, anything that requires clinical judgment cannot be delegated, okay, or critical thinking. All right, so it talks about stable patients, being a good supervisor. And I'm just going to mention this because I was talking with my class tonight about it. Um, if there is a scenario, like if the nurse is impaired, or the nurse is we think the nurse is pocketing medication or something along those lines, we never confront the nurse. We always report it, right? Because we don't ever want to confront someone and escalate a situation. We will report it to the chain of command. So it could be the charge nurse, right? If that's one of the choices, but we want to report it. And in a scenario like where the nurse could be impaired is maybe she has 6 patients and all 6 of them received their PRN. It was documented that all 6 of them received their PRN pain meds. Or maybe it was documented that all of them received their pain meds, but their pain is still not relieved, right? That's going to be kind of unusual. Okay.
Yes.
And when we think about that, we're thinking about, narcotics or opioids. Okay. So that's just an example of a potentially impaired nurse. Okay. So being a good supervisor, okay, things to consider. Okay, so when we have a patient that is being discharged, we know that discharge teaching takes place upon admission. It starts. And when we are sending a patient home, maybe they're not going home, maybe they're going to an assisted living, maybe they're going to a long-term care, but we want to make sure that the patient has all of their devices, if it's oxygen, if it's crutches, or whatever assisted devices that they're supposed to have. Is the patient going to be able to care for himself or herself, or are there home health services that should be requested? Is a social worker needing to be involved? All of those things are things to consider as we plan for our patient's discharge. Oh, what happened? Okay. All right, so additional resources. Okay, so initiating the plan of care, and that's of course what the RN does. And remember, we're always using our nursing process. We're always thinking in terms of ADPI. That's
Yes.
going to be important, right? So your assessment, your nursing diagnosis, your planning, your intervention or implementation, and then evaluation. That's really important to never lose sight of that. And so with the Kaplan decision tree, it talks to us and it reminds us of that, right? Is this an assessment kind of scenario, assessment question, or is it an implementation? Do I have to do something? Okay. Any questions so far?
No, ma'am.
Okay. All right. Patients' rights. We know that patients have rights. They have the Bill of Rights. We want to protect the patient's health care information. That's the HIPAA. We don't want to share their information unless they have given permission. Just because someone is their loved one, that doesn't mean that we have the right to tell the patient's business. I had a patient one time. He was an adult patient, but his mom was in the room with him and she never left, like only just to go to the bathroom and to get food. But he did not want her to know that he was HIV positive.
Yes.
And when we gave his medication, we didn't say anything. We just handed him the pills and just said, "Here's your medication, Mr. Smith." And from there, because he didn't want her to know. So just because it's someone's mom, so their dad or spouse, right? A lot of times the spouses will say, "Okay, I don't want my spouse to know that I have an STI," right? That could be a bit of a tricky situation, right? So we have to make sure that we don't disclose information. Okay. So patient has a Bill of Rights. Patients have a right to their information. Now, the medical record itself belongs to the facility, but the information in there, the patient can have access to it. So a lot of times now you'll see patients that will have like electronic medical records, like they can access it and they can see their blood work and all of that. Okay. Access to emergency services, they have right for that. They have the right to participate in their treatment decisions. And one of the key phrases that we would always document is patient is participating in care. You always want to try to include the patient. And if the patient can't participate, you want the family to participate if possible. Okay. All right,
Okay.
confidentiality, talked about that, the Bill of Rights, informed consent. So informed consent, the nurse is responsible to make sure that that signed informed consent is in their record. If the patient, for example, is having a procedure, the doctor is going to be the one to explain the procedure. The doctor will be the one. If the nurse notices by body language or if the patient says, "I don't really fully understand what the doctor said," we have to call the doctor back in so the doctor can explain again. That's going to be really important. Okay, because the patient has the right to fully understand the procedure before it actually takes place, right?
Yes.
Let's see, management. So roles and responsibilities, we're problem solvers, talked about HIPAA, continuity of care. That's always an important factor. Why do you think continuity of care is important?
Because you still need to let the patient know that as you're leaving, you have to follow up with your doctor one. And like you said, if the patient is going to facility, everything has to go with the patient, and you still need to pass up reports to
Mm-hmm.
whatever facility the patient is going to.
Mm-hmm. Yes, excellent. So continuity of care is yes, it can mean many things. The follow-up appointments, maybe the patient needs to see a specialist. Maybe the patient was at a specialist. Now they have to go back to their primary care provider. So the primary care provider can say, okay, you saw the you saw the gastroenterologist, you saw the urologist. Now I'm going to send you to OBGYN. So that primary care can be looking at all of the different specialists and make sure that there's nothing conflicting or really paying close attention to what's going on with the patient. Also, continuity of care could be that, okay, I'm going to assign that same nurse to the patient because they're familiar with the patient's case and they know they've been tracking the patient's, uh, you know, um, I guess, status, if it's improved, so they really know the patient. Because if you have the same patient for a couple days, you really get a chance to establish a relationship with the patient, that nurse-patient relationship. You can say, okay, wow, Mrs. Smith, when you came in, your vital signs weren't that great, but now your vital signs have stabilized and, your lab work is looking good, or, vice versa. You can see that, whoa, Mrs. Smith is starting to decline. So, and that's something that, okay, because you can compare it from what was their baseline or when you first started working with the patient. So, that's another way continuity of care can be important. And also giving that good shift report or that handoff report is going to be important as well. Something I was sharing with the students tonight is make sure that you do a bedside report. Go
Yeah.
in with that offgoing nurse and look at the patient in the eyes. Make sure they're still alive, right?
Mhm.
Okay. All right. So guidelines. So whenever we have prioritization kinds of questions, we're going to be using Maslow's hierarchy for sure. We're going to be looking at airway, breathing, circulation. We're going to use Maslow's hierarchy. We're going to look at those physical needs first, and then we're going to go to the higher level needs. We're also going to be looking at what is the policy state, right, for our particular institution. We're also going to be looking at, the patient, helping them to understand their needs and taking their opinions into account. We're also going to be looking at the patient activity. And this is a big one. If you see changes in the level of consciousness, that's always kind of like a big red flag kind of item when the
Yeah.
patient has a change in their level of consciousness. Okay. Medication priorities, we want to manage that, and medication reconciliation is super duper important because it allows us to say, okay, is the patient still taking this medication? And if they are any of these medications contraindicated with each other? Or maybe we should let them take this medication in the morning and then 2 hours later they should take the other medication so that there's no issues in absorption or anything like that. So that's another thing you have to look for. Okay. Any questions so far?
No, ma'am.
Okay. All right, so when you're managing the patient's care, we're planning the care, right? And this is kind of like what we were just talking about, what you just mentioned, like the post-surgical patient. We know that this patient, we're going to be frequently monitoring their vital signs. We're going to be looking at their pain management. We're going to be looking at their airway. We're going to be looking at their fluid electrolytes because many times if your patient has had surgery, they have been NPO from anywhere to 4 to 6 hours, maybe even up to 8 hours prior to, right? We're going to look at baseline status deterioration. And so that's another thing to look at before the patient goes for procedure. We're going to let them get their vital signs, right? Looking out for patients that are in shock. A lot of times when we think about patients in shock, we think about hypovolemic shock. And that could be your patient that is hemorrhaging, and we know that the blood pressure will drop and the heart rate will increase. They'll have tachycardia. Okay, so that's, one of the main things we look out for. Now, there's different kinds of shock, but that's when we think about shock, probably the first thing that comes to your mind. Now, there is allergic reaction where the patient can have a severe allergic reaction and they can actually have anaphylactic shock. And so this is your patient that may be allergic to peanuts and, unfortunately they were exposed to peanuts. And so Our primary thing to focus on as that nurse is to make sure they have a patent airway, right? Patent
Yes,
airway. Chest pain. So whenever a patient has chest pain, I'm thinking, okay, like I'm looking at the clinical cues because that's what NCLEX is going to test you on. You might see chest pain that is really the worst pain they ever had. It feels like an elephant sitting on their chest. It could be radiating down their left leg, their left arm, their jaw, their back. Remember that women and diabetics may present a little bit differently. But if this patient has chest pain, they also may complain, or they may also have pallor. They may have diaphoresis. So those are classic signs of a patient having an MI. In my nursing mind, I know I better get that EKG. I better get the vital sign. I know this patient's going to be on telemetry. I know that MONA is what we use, right? Morphine, oxygen, nitroglycerin, and aspirin. So we have to monitor all of those things when we're caring for this kind of patient. Um, Whenever a patient has a diagnostic procedure, excuse me, I always want to compare the baseline, but if it was an invasive procedure, I also want to monitor the vital signs because I'm afraid of hemorrhage. I'm afraid of infection, right? Hemorrhage will
yes,
kill a patient faster. Okay, awesome. Now, unusual symptoms. If you have an unexpected finding in a test question, NCLEX question, that's usually the one, okay, I better notify the healthcare provider. So if I have a patient that has had an MI and then he tells me that he has large, bright red clots in his urine, that's an unexpected finding with an MI patient, right? If it was, and I will tell you, large, bright red blood clots is definitely a cause for concern, and no matter what kind of patient it is. But that's an unexpected finding, okay? And you could see that like in your postpartum patient, if they have bright red clots, I'm going to be concerned, especially if they're larger than a quarter, right? I'm concerned about postpartum
yes.
hemorrhage.
Mm-hmm.
Okay, awesome, awesome. Okay, unusual symptoms, again, unexpected findings. These unusual symptoms could also mean that the patient's condition is worsening, right? So we have to think about that. And NCLEX is going to test us. Can we notice by these clinical cues that, hey, your patient is deteriorating, right? Because NCLEX is testing us if we're going to be safe nurses. Um, and then malfunctioning equipment, I always remind my students to trace everything that is connected to the patient. So
Yes.
Foley catheter, oxygen, IV tubing, chest tube, make sure that it's traced and it's
Mm.
connected, right, to what it's supposed to be
No kink.
connected to.
Yes.
Mm-hmm. No kinks, and if it's a Foley catheter bag, right, it's hanging below the level of the waist, below the bladder, right? So all of those things. Any questions so far?
No, ma'am.
Okay, awesome. All right, so here's some vocabulary words for sure that are important. Now, we know that as nurses, we're governed by the American Nurses Association Code of Ethics. And we think about autonomy, that is the patient's right to make their own decisions. Beneficence is doing what is in the best interest of another. And justice, that's providing fair, equal treatment to all patients. Something that I always mention is that everybody looks the same in a hospital gown. It doesn't matter if you're President Joe Biden or if you're the guy that's making French fries at McDonald's. Everybody looks the same, and we should treat everyone fairly. Okay. Non-malfeasance is doing no harm. We don't want to harm our patients. Fidelity is going to be faithful. And so if I tell my patient that I'm going to come back and check on you in 10 minutes, come back in 10 minutes. Now, if you're not able to come back, something may have happened, let someone know, can you please go tell Mrs. Smith that I can't check on her right now, but I'll be in as soon as I can? Because that way you're going to be able to build trust with your patient, right? Um,
Yes.
Virtues, integrity, honesty, trustworthiness, and compassion, which are standards of nursing. course. Confidentiality, we talked about with HIPAA, and then accountability, we have to be accountable for our actions. Okay, so informed consent, we kind of mentioned before, and that informed consent has to be in the patient's record, and it tells what the treatment is or what the procedure is, the risks, the benefits, any alternatives, and if the patient refuses, what could happen. And of course, if it's, usually procedure, they can say that, okay, there's always a risk of death, right? That's one of the things if your patient's having a procedure. Okay. And so we'll facilitate informed consent. We can serve as a witness, but again, it must be scanned into the record by us. And if there's any questions, we contact the doctor to come back and explain to the patient. So EHR is electronic health record, and EMAR is the electronic medication administration record. Okay, legal rights. So the Nurse Practice Acts is determined by each state, and that tells us what we can do in the scope of our practice as a CNA, as an LPN, as a registered nurse. Okay. Malpractice, when we think about malpractice, it's a little bit different from negligence because there's the element of intent. So when we think about negligence, it's what would a wise, prudent nurse of the same education and experience do, right? When we think about malpractice, there has to be four elements met. There has to be a relationship. There's a duty of that healthcare professional to be caring for the patient. What's the other ones? God, we just talked about it tonight. There's a breach of duty. Harm had to come from harm happened to the patient, and there's one more thing. Um, I
Patient's
think
private.
it's a privacy. I think the care was not competent. Something that a wise, prudent nurse of the same, education, background, and experience wouldn't do the same thing.
Okay.
And there has to be intent for malpractice because malpractice is a serious form of negligence. It's a more serious form of negligence. Now, if some kind of medication error happens, there's some negligence, there's some kind of malpractice, the first thing that we're going to do is to check the patient. We will assess the patient. So it could be like a wrong medication dosage given, right? The first thing we want to do is assess the patient. And of course, we're going to write an incident report, but remember that incident report does not go inside the patient's medical record. Okay. All right. So the nurse, we have to respond to legal issues, seek assistance, patient valuables, make sure those are secure. Okay, we talked about organ donation. Let's just talk about a living donor for a moment. That's usually like with your kidney patients or your bone marrow. So living donor just means that the patient is still alive. And yes, we can donate a kidney because we have two of them. And you can live technically with one kidney. And what happens is that the remaining kidney will get larger to carry out the needs of the body. Now, the patient that is the recipient of an organ will have to take those immunosuppressant medications, right? So if you see questions like that, I'm concerned about their immune system because they're going to take those immune suppressing medications.
I have a
So,
family that died from that. I
oh no.
think he reacted to the kidney that was given to him. Or
Oh,
I believe he wasn't taking his medication properly.
mm,
That was what happened to him because
oh,
he's an older guy anyway and got his kidney from this younger guy that had an accident. And
mm,
ever after the surgery, he was good for the first couple of months, going
mm-hmm.
to about 5, 6 months. He started complaining and everything. And before we know, he passed on.
Oh, I'm so sorry to hear that. Wow. It's always tough because you never know how the recipient's body is going to, react. And
Yes.
it's a foreign body. And if he didn't take his medication, That could be
But
one thing.
don't they do like this blood compartment, all those things like we do in blood donate, like receiving blood and all those things?
Yes, yes, they do a lot of tests because actually my mom is a kidney patient and I was trying to see if I was a donor, so I had to do a lot of initial screening to make sure that we would be compatible. Um, and so yes, you do a lot of screening. You have to have a colonoscopy. If you're a woman, you have to have a mammogram, and they do your blood type. So you're absolutely right. There's a lot of screening that goes into it for the patient. But even with all the screening, of course, something could go wrong. And if the patient is not taking their immunosuppressing medications, the body will reject that donor organ. They'll see it as a foreign body and they could possibly attack it. So yeah, that's true. Okay. Wow. Okay. I think that is the end. All right. Let's go ahead and jump into these questions and we'll practice kind of breaking these questions down. So you can just take your time. You can read it aloud if you want and let me know what you think.
Fair share of tax. See if we earn loss on the exchange report, the staff frequently level ups. Also completed, which of the following statement should charges make to resolve the I need to talk to you about need expectation during delegate. Serious staff have recommended that you don't if you the chef. I'll take A.
Okay, awesome. A is correct. How did you get to the correct answer?
Because the charge nurse has at least the report must have come to her on several occasions. So in resolving of the issues or the situation and she will need to talk to the the staff member that is delegating the taxes. Because if you look at it, it said one of them have unfair share of tax.
Mm-hmm.
And that doesn't make sense. You have to make it equal. If there are 10 patients, you can't give one 7 and give the other one 3. It has to be at least 5 patients each so that the work can be done equally. If I have 7 patients and you have 3 patients, I can't finish everything that I'm doing.
Mm-hmm.
Especially when they are demanding, like you said just now, if the patient, I told the other patient, oh, I'll be coming back in 5 minutes, and I wasn't there in 5 minutes, and I
Mm-hmm.
don't have anybody to send to meet the patient. That's a breach of trust there. So,
Right.
and I don't
Okay.
want it to be that kind of situation.
Okay, excellent, excellent. And so I love what you're saying. And also you want to be non-threatening
Mm,
whenever you have, situations with your patients and your coworkers. You want to be non-threatening. You want to use therapeutic communication. You don't want to be confrontational. Now, I will tell you though, there's one time where you have to just confront something. So, and that's in the terms of like if it's a sexual harassment kind of scenario, if the patient says something that's sexually inappropriate, or if a coworker or a supervisor, if he says, or if she says, if you want to get this promotion, you need to go out on a date with me. Or if the patient says, I really like the way you look, or something like that, would you be my girlfriend? Immediately you must say, Stop right here. Those comments are inappropriate. I am offended. Cut it out. You have to, in no uncertain terms, let them know that. And then, of course, you're going to report it up the chain of command. But you have to let them know because what would happen is they'll say, oh, well, they didn't tell me that they didn't like the comments. They didn't never say anything, right? So you have to immediately confront that kind of comment from a patient, a coworker, or even a supervisor. Okay. All right. Great thinking. Okay. Let's look at question 2 and tell me what you think. Take your time.
data for children should not safe first. 10-year-old sickle cell anemia, that's a bridge there. With chest pain, 7-year-old diabetes mellitus renal. Oh, specific gravity. What's my range? What's my range? I see my specific gravity. Six. 6, and the range is 1.030. That's talking about my range. That's good. Between the top of house, also temperature state. So asthmatic patients with BUQ. Okay, I have two things here. In fact, the three are like two is like the red flag. That's the A and
Mm-hmm.
my D.
Okay.
And
All right, so you eliminated B and you eliminated C, so that's good.
this
Okay.
can be controlled. Um for the sickle cell with chest pain. Oh Jesus, an asthmatic patient. And that's really toxic. It's above the range. Oh my God. Um, I'll say I'll go for the D first because of the airway.
Okay, okay. So it's not necessarily that one, and I think this one is tricky because the lab value.
Yes.
So let me just get the right lab value for you because I think 15 to 70 is the range for children for PCO2. And so remember, CO2 is going to be the partial pressure of carbon dioxide. So for that pediatric patient, that's actually normal.
Okay.
Um, I don't have the actual range and I don't remember it. I'm sorry, I don't want to give you wrong information.
I'm looking at it.
Okay, do you
Um,
have it in maybe in your textbook?
yeah, I'm looking at it right now. For the
Um,
PCO2. Okay, the range is actually good here.
yeah, so
Mm.
what I
The
found
first one,
online,
first one should be for the sickle cell with chest pain.
right? So the range that I found something that says 38 to 42. Is that what you found? Close?
I found 35 to 45.
Okay, so that's good. So that tells you that this PCO2 is normal, right?
Okay.
So A is the correct answer because when we think about sickle cell, we think about what the complications, and that should be like how, as you study, that's one of the things you should always look out for. What is a complication of this? What are the clinical cues? What is the patient going to look like? Now, we know with sickle cell anemia, the patient is going to have red blood cells that are sickle shaped or crescent shaped, and they can actually get stuck in the vessels. And that is what causes that crisis. Okay. And so, and I would submit to you whenever any patient has severe chest pain, when they have severe pain, that's a big red flag and we need to assess it. The other thing with this, and I'm going to put the rationale in the chat, is we're looking at urgent versus non-urgent. Okay. So if your 10-year-old child has sickle cell anemia and they have this severe chest pain, I'm thinking they may have acute chest syndrome. Okay, and that's one of the things is a complication of sickle cell. The patient's having a sickle cell crisis, and now they have a sudden onset of severe chest pain. And this is a medical emergency. Okay, so, and that's what is testing you. Do you realize that these clinical cues is painting a picture of someone that has an unexpected finding or a finding that is urgent? And so I like the fact that you crossed out B and C because you're like, okay, those are expected findings of those the conditions. Okay. And they always try to trick us with asthma because they know that we're beating into our brains, airway, breathing, and circulation. Okay. But that was good. Okay. Any questions about two?
No, ma'am. No.
Okay,
At least you
awesome.
gave me a clue that you said anything about severe chest, about severe, I should like circle it because that is a red flag there.
Yes, for sure,
That is
for
fine.
sure. And if you had to guess, definitely severe pain is going to require further evaluation. So if you
Okay.
have a question and you're kind of like, I have no idea, severe is never a good thing. Okay.
Mhm.
All
Okay.
right. It's question three.
A nurse is preparing surgeon messages. Nurse I asked about the surgical medical diagnosis. The nurse responder is unable to provide that is not provide information. Nurse's information. That should be number 4. Non-maleficent, in the sense that um you don't want your patient to die. You need to know what's wrong with your patient because our obligation is of the physician, but not to harm the patient. So I'll say number 4.
Okay, yes, and that is correct. Non-malfeasance is right, doing no harm. That is our oath that we have taken. Now, utility is the ethical principle doing good for many outweighs the good of one. And
Mm,
paternalism is a belief that one individual has the right to make decisions for another. Sometimes you will see that in like Mexican cultures. That's one of the things of like for cultural competency. They may make the decision for another. You can also see that in your Muslim culture sometimes. Okay,
mm,
justice is everyone should be treated fairly, and then non-malfeasance is doing no harm. Okay, awesome.
mm.
Okay, any questions about that one?
No, ma'am.
Okay, number four, please.
When planning the equation starts if and also consider 5 right obligation. Should the following should the nurse consider when using something should must consider when using the obligation. Leads to price, knowledge, and skills of the tasks of the clients to complete tasks without assistance. Mm, 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 mm. Come on now. Think more, think more. Next one. How's it be?
Okay, B, that is correct, right? So this is one of the five rights of delegation, right? Understanding the right person based on the Nurse Practice Acts. So excellent. Do you have any questions about this one?
No, ma'am.
Okay, awesome. All right, let's go to the next one.
If a public health nurse is assessing an old client who believes family member, the nurse identifies several processes and various stages of healing. How the nurse and the family members come explain And as a result of clumsiness. That's not good. However, based on the constitution, no suspects abuse, which of the following actions should not take document the presence of the charge, report findings, supervisor, what the answer. Oh, I'll say report to your supervisor first
Okay, yes. Okay, how did you get to the correct answer?
because your supervisor will be the one that will call the hotline, the crisis hotline, or comfort the family because she
Okay.
can, because they said clumsiness, which means they're not taking care of him. We know he's an elderly patient and he need more care. If they can't, then they should get either a home health nurse or transfer him to the facility.
Mm-hmm. Yes, and so you also notice that we are mandatory reporters of child abuse and elder abuse, and these are all the telltale signs of abuse. And so remember, abuse for child and for elderly, we must report, and it could be physical abuse, emotional abuse, sexual abuse, neglect. They're not getting the care that they need. Maybe it's winter time, they don't have a winter coat. They're not getting their medication. So these are all different forms of abuse. Spiral fractures, bruises, like in this question of unequal healing, and the story not adding up to the actual injury. So these are all things, and we must report it right away. Okay, awesome. Okay, question 6.
Question 6. Wow. Mm-mm. Okay, quick. Suspense and neither injury. Which of the following action should not take first? You need to wash, 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 wash. See,
Yes, yes, that was an easy one, right?
it's no.
So whenever we have a break in skin, it could be a needle stick, it could be, a children at daycare, a child bites them, or whenever, a raccoon bite, whatever it is, it's always washing the site with soap and water. That's going to be the first thing. And of course, all the other things we're going to do, right? But again, this is a priority because it says first. Okay, excellent work. Okay, question 7.
Nurse is caring for a client who has named a person to serve of healthcare state he needs clarification about what the type of governance directive which of the following statement likely indicating new need for clarification. I have to choose family about the problem. Yeah, you need somebody to choose because I want to change who I didn't design as well at any time. I will find a calculation end of time. Oof, his kid doesn't go with it. I'll say C.
Okay.
What's
Yes, that is correct. Right. Review the events leading up to each medication administration error. Okay. Oh wait, sorry, I'm looking at the wrong one. But that's sorry, that was the answer for the next one. But C is correct. So the client should choose someone that they trust. It doesn't necessarily have to be a family member though, right? So,
the
okay,
promise?
awesome, very good. Okay. Any questions about that one? I felt like that was an easy one for you.
No, ma'am.
Okay, awesome. Okay, I'm gonna skip 8 because I mentioned the answer already. We're gonna go to 9.
Says unit is concerning new and by medication. The nurse is reviewing the person's medication consultation with a newly licensed nurse. The nurse should indicate which of the following information is also on medication. Demonstrate an ethic principle of balance system. Wow, this is gonna as a sequence calculation. Within the process of medication calculation. I'll say B.
Okay, yes, that is correct, right? And the medication reconciliation is, okay, what is the patient taking right now? And we want to make sure that we decrease the risk of interaction. So yes, that is excellent. All right, any questions on that one? No? Okay, awesome. Okay, let's look at number 10, please.
Oh, oof, this one is. Okay, where's the medication? Warfarin, Warfarin, let me look at the rush. Warfarin, okay, NR. Orange is, and we're having 3.5. So we have 2 points, 0.02, 3.5, 3.0. So that's high. The client states he's checking herself out of the hospital to get on to the discuss situations with her, which was the following action. Should the nurse take? Tell the client she will not be permitted to leave facility until she signed. Tell the client she leaves without written prevention of discharge by insurance. Explain the risks if she leaves facility. Ask the security guard back home. Can't force her not to stay. She wants to go. She has a right to go. I think she has to sign. She won't be permitted to leave until she signs. Why am I forgetting this thing? I know she needs to sign, but we don't need to withhold her. Oh God. Explain the risk she faces if she leaves facility. Need to let her know. Oh my God, I'm in between two things. Tell the nurse if she leaves. Tell if she leaves without written prescription for discharge, the insurance will not pay. That's not necessary. Oh God, in between 1 and 3. Oh, it's out of it. The risks she faces if she leaves the facility. This is to wait, right, to discuss the situation with her. Tell the client she will not be permitted. Don't have to withhold. That's a case rule. Tell the client she lives without. She already have the information in there. Insurance should definitely pay. Something else use. I'll just see because you have to let her know about her health first.
Okay, excellent. Okay, so you're right. That is the correct answer. So we want to let the patient know what can happen, right? Let her know the risks. So that is excellent. So I like how you were breaking this question down. You were kind of torn between two answers, it seemed like, but you did a great job in selecting the correct one. Any questions about this one?
No, ma'am. No,
No.
ma'am.
Okay, and I've been trying to put all the rationales in the chat just in case, so hopefully you're seeing them too.
Okay.
Okay, awesome. Okay, let's go to 11, please.
A nurse in a med-surg unit is planning to delegate this to an adult volunteer. Which of the following tasks should the charge nurse avoid assigned to the volunteer? Delivering meal train to the rooms should not be assisting from meals in tray. Allow 7. One client who is confused. I'll say D.
Okay, yes, perfect. How did you get that one so quickly?
Because it's a volunteer and you don't want him being in the room with the patient. When they can't deliver tray because there are no staff and they
Mm-hmm.
are not in territory either. And with the delivery of specimen, no, that's out of it.
Mm-hmm.
It's a
Yeah.
difficult one because you don't know if the client can swallow or cannot swallow. You don't want to do that. So the best thing is just to sit with the patient that is confused. At least that one you can monitor the client and call when you need backup. But with the other three, out of it.
Okay, right now, be careful because you got the right answer, but this is it's a negative question. This is the one we should avoid assigning to the volunteer. And I think maybe you saw that. Yes, right? So we don't want to give the patient, the post-operative patient who is confused, right? Because, and I think, yeah, I think you said that right, because they're not staff, they're not stable. So we won't give that one to this patient, to the volunteer, rather. Okay, awesome. Any questions on that one?
So because they volunteer, we don't need to do that. And I know with feeding of the patient, they can do that. So the main thing they can do is just to pass the tray.
Yes.
Passing of the tray will be better.
Okay, yes. So this question is a negative one. It's saying which of the following tasks should the nurse avoid assigning to the volunteer?
Yeah,
So,
I mean, for instance, if they don't avoid, we don't want to avoid that. Let's say this the number 4 answer is not included. For the
mm-hmm,
other three, they can't do 2, they can't do 3 because they don't know if the patient has difficulty swallowing and they can't carry specimen either. So
right.
A should be the one they can do just to pass the tray and they leave.
Yes, so they could definitely give the tray. Now, the volunteer can tell the patient, this is, mashed potatoes at your 12 o'clock. This is, let me put your spoon in your hand. Like the volunteer could do that, right? Because it just says they have difficulty seeing. It didn't say that there's aspiration risk or anything like that. It's just a visual impairment. So that's
Like when we're
okay.
doing the circle clock plate now
Mm-hmm.
and tell them this on your 6, this on your 3, that's on your 9. Okay.
Right, right. So the volunteer could do that. Now, delivering a routine urine specimen to the lab, yes, the volunteer could walk that down. That's okay. That's
Okay.
okay. Okay, because that just anybody could do that, right? Okay, take this bag to the lab. It doesn't necessarily have to be a staff member. Now I haven't really seen volunteers do that in a healthcare setting. Like I've seen volunteers like bring flowers, like maybe water pitchers, that kind of thing. But again, we're in the NCLEX world, so this is a possibility that the volunteer could do all of these things. But that post-op patient that is confused is unstable. So that's why they can't be with the volunteer. Does that make sense?
Yes, ma'am. Yes, ma'am.
Okay, awesome. Okay, I think we'll keep going to 15. Now, hopefully you have time for that because we're at 12, question 12 now.
NSNAP tells the nurse manager that she observed a nurse on the unit removing a small amount of morphine from each parent to administering the medication and claim which of the following action should the nurse manager take first? Whether that does from performance unless it's straight upward. What would notify the risk when by the nurse for the wow. Um, I'll say gather more data.
Okay. Okay. Awesome. That is correct. Okay. You've been doing fantastic on these questions. Okay. How did you get to the correct response?
Because the um since it's a syringe and the medication might not, there's a volume of which the patient can take, the clients can take, like we said before, if they still complain of the pain, which the medication wasn't passed,
Mm-hmm.
go stay with Ome. When I'm done, I'll get you, please. Thank you. I'm almost done. You stay with OT. Please. I'm sorry.
That's okay. That's okay.
Wants to sleep with me in my room
Of
because we're supposed
course.
to be bed.
Okay. Of
Okay, come and
course.
lie down. Come and lie down.
Okay. We only have three more questions. Okay. So 13. And
Okay.
if you need to go, that's totally fine.
I want to finish.
Okay. Okay.
A nurse is caring for a client who has severe head injury and declared brain dead. Oh my God. The transplant coordinator has spoken with the client's family about organ donation. The client's spouse stated that she is confused and does not know what she should do. Which of the following response by the nurse is appropriate? There is such a shortage of organs in the country, so I think you should go ahead and consent to your spouse. Okay. What do you think your spouse would have wanted? Or should they just be with it? Do you think it's better? Okay. I'll say B.
Okay, for 13.
Yes.
Yes, that is correct, right? And so I'll put the rationale in the chat, and you've been doing fantastic with these questions. It's, yeah, what do you think your spouse would have wanted? And we always want to kind of take that into consideration. And so that's a great question for the nurse to ask. It's therapeutic. So awesome. Okay, 14.
14. A nurse manager is receiving good Samaritan law with a licensed nurse. They show the following statement by the nurse manager is appropriate. Good Samaritan law. I think that's when you do without nothing held against you. That should be it. If you render aid in an accident, do not leave the scene until another competent person can take over. Good Samaritan will prohibit the victims from filing lawsuit against the nurse. The federal law requires licensed render aid in an emergency. A nurse who volunteers this work children is covered by a Good Samaritan. Mm, um, I'll say B.
Okay, so this one is not B. What was your second choice?
My second choice is an emergency. A Good Samaritan law. Oh Lord. I know it was not supposed to count against the person. I think
Mm-hmm.
it should be an emergency. It should be an emergency C.
Okay. No, so C is not correct.
Okay, so
Okay.
I have two now.
Yes, so it's either A
Aid in
or
an
D.
accident. Do not leave until a competent person, a not voluntarily, newly licensed. I'll say A.
Yes, A is correct. And I'm going to tell you a moment ago that these questions actually, it's kind of like you were right there in my class today because we talked about all of these different things. So this is actually going to benefit my group from earlier. But we talked about the Good Samaritan laws with them. And so one of the things that I mentioned is if you are operating in your scope of practice as dictated by the state Nurse Practice Acts, then you are covered. So if you are, performing CPR on the roadside and you break someone's ribs, you're going to be covered because you can't be sued because you are operating in the scope of your practice. You have training on CPR, right? And
Yes,
so
ma'am.
now the thing is, once you though, like if you see someone on the side of the road or at the mall or the supermarket and you start rendering aid, you cannot leave that person because now you have established a nurse-patient relationship. So you can't leave until somebody else arrives, like the paramedics, EMS, or until you are physically exhausted that you can no longer continue. Okay. So that's what happens when we start caring for a patient because we are nurses. Now, if you were a lay person, then of course it would cover you like if you were trying to render aid and the person got hurt a little bit worse, then that would cover you because you were just trying to help the person. Okay. Does that make sense? The difference between a nurse and a lay person?
Yes, ma'am. Yes, ma'am.
Okay,
You
awesome.
know, this thing that just happened now, I think, was it last year? We're going to church and just in front of the school there, an elderly man was riding his bicycle, and all of a sudden he just fell down from this bicycle.
Oh
He
my.
got dizzy. Yeah, I have to go down and park. Another lady in front parked again. She was a nurse. She was
Oh.
going. So I was the first one to get there. So I helped him. I asked him what happened. He said he was going to the hospital that he wasn't feeling fine and he just got dizzy.
Mm,
I stayed with him and I asked him, do you want me to call 911? She said, the man now said, no, the lady now came. She now showed me her badge and I showed her my student ID. I
mm,
saw it and I saw it was an arrowing. And she now asked him what happened. She said she saw the incident actually. And she saw me
mm,
stop. I stopped before her. So she now helped the man to the vehicle and we have to roll the bicycle to front of the school in the
mm-hmm.
parking lot there. And we chained the bicycle and I drove off to church and she took the man to the emergency room.
Yes, excellent. Wow, that's a great story. But yes, so you, even as a student, you had an obligation, but you were relieved because then the registered nurse came. So,
Yes.
yes, so excellent. So if that registered nurse did not come, by ethical laws you could not leave that person
No.
and
No.
probably you would have called 911 even though he didn't want you to call 911, but that would be the best thing to do. Okay, awesome. Okay, that's a great story. Okay, awesome. Okay, last question, 15.
15. A nurse has applied for a promotion. A hiring manager. Internship. Oh, that's harassment. Then the nurse will take a hiring. Experience that immediately report the behavior to nurse manager. Right. Tell the hiring terms of conduct of discomfort behavior. Stop immediately. I think that should be A. She has A.
Yes, that is correct. And this is so funny because again, this is exactly what we talked about tonight with my class. So I think this is going to be of great benefit to them. And hopefully it was a benefit to you just as a refresher. Okay, I'm going to check in with you. I'm going to stop recording.